the price of medicine.
Hi, and welcome to Medical Malfunction. Oh, just hopped on to, are we giving you a little bit of, it's not really agita, it's just maybe equity. Equity is that bad word these days. We're not allowed to say it anymore. It's kind of funny. We were trying so hard to get there, and then suddenly it was like, no, we don't say that word now. We have to take it out of everything. It's pretty funny. But I was reading a little study today that was talking about employer contributions to health insurance. So while we're all freaking the out about how much health insurance costs have gone up, let's talk a little bit about who carries the burden in the United States, where we have employers sponsored health insurance for the most part. Obviously, there are other programs and other ways to get it, but I want to talk a little bit about this because there was a new report today, and I'm going to give them some credit. Let's see who put this report out. There was more to it than just what they said. 2025 trends shaping the health economy. So this came from Trilliant Health. So one of those curious made up marketing words. Trilliant sounds like brilliant, but it isn't really. And so it's a pretty long report. It's a pretty I'm sure you'll find it totally exciting. But I wanted to share it because there was one really curious number that I thought, I don't know if it'll make you feel better or if it'll make you feel some sense of satisfaction. I don't know. It could go a lot of different directions. So I thought I would share it and let you decide because it's your emotional roller coaster. You ride it how you want to ride it. I like to throw my hands up and scream. No, I don't really actually, but I do like a roller coaster if I'm allowed to do it. And yeah, and here we go with I thought, oh my gosh, I'm gonna have a good hair day. No, if I had known that my carrot top era was like it's still way ahead, I might not. No, it's actually been looking pretty good lately. And then today I was like, oh, I'm gonna podcast, and it decided to go totally haywire. But we like Carrot Top, and he's funny, and he's been doing some cool stuff on social media lately. So if you haven't seen him lately, go check him out. But let me show you these numbers. I want to show you these numbers because I think they're interesting. There's some math, but it's some easy math. And maybe it'll make you a little, I don't know, grateful, a little bit more appreciative. So, what came out in this study was a very curious number. This is growth plan of health plan contributions. This is the cost of it now, based on employer versus employee. And if you look on the employee side over here on the right, that's the far right. I made a very boring slide, so you could really just look at the numbers. Sorry. Um, but this is from 2010 to 2024. Look at the damn difference in how much it has, I would say, hit our wallets. If you're an employee, I'll just assume that you are. I'm sure many of your employers too, versus what the employers got hit with and what they're carrying. Now, we talked already about self-insured, um, and then, employers who, just like kind of buy in a group plan versus being self-insured. And most employers are self-insured. So we've explained that concept a little bit, but and what that basically means is that, your employer pays for your healthcare in the sense of like, yes, you have like an Aetna or a Blue Cross or whatever. That's basically like the network kind of thing, and then they negotiate the rates and do all of that part for them. But most employers are self-insured. They pay for you and or your family's healthcare costs. So that's why being a high utilizer can be very dicey. Keep your mouth shut. PHI is PHI for a reason. That's private health information. You don't want to be that big dollar sign walking around the office. I'm that big dollar sign right now. I'm becoming less of a dollar sign, but still. Um, Keep your mouth shut. You can, because it matters. So if you look here, employer and employee, you see it starts out, it's a benefit. It's considered a benefit. It's an attraction to make their company attractive to you to come and work there. It's not something they owe you. It is not, but in this country, it is rather an expectation because that's the way our system has been set up, obviously. And you see, you get to around 2017, the balance starts to really be out of whack a little bit. But our cost as far as employee generally hasn't gone up too much as far as what we're paying. Now, it doesn't mean that the cost of insurance hasn't gone up. We're talking, kind of like get to 2024. Wow, big difference. In fact, a 19.3% difference. So I put that little math in there. Um, that's a big difference. So your job, whatever your job is, there is a massive value in the health insurance that your company picks up. And that includes your premiums. That includes if you have an HSA option and they contribute to it. Use your FSA. All of those things, reduce your tax burden. Burden being the key word. Saves you money, does all of the things that you want to do to maximize, because at this point every dollar counts. They talk about shrinkflation, they talk about inflation, they talk about deflation, they talk about whatever kind of inflation you got, they're talking about it. So just think of it that way. But this is one way where employers have been hit harder. And yeah, robots don't really need the same kind of, but they're not without maintenance cost. But yeah, here's where you can really make a difference. And like I said, when you got a health condition, shut up. No one needs to know your business. Yeah, if you have some doctor's appointments, stuff, get your FMLA in order and take your doctor's appointments. But no one needs to know all your stuff. Shut up. It's your business, and there's protections in place for a reason. So keep your privacy yours and your family. This goes for kids too, and spouses. You may have a spouse going through cancer treatment or a kid going through some major medical situation. Shut up. I mean, I know you want to share it with whatever the world, but the fact of the matter is, it can have consequences that you're really not thinking about because, again, your employer hears, and it's not legal to judge that way, but it's also not legal. There's always, you know, right to work and this and that. So you gotta do what you have to do and be private about what you can be private about and be mindful of it, because this is not a small number. What I would do is maybe try to be a little bit grateful for it, because we know what people on the exchange are going through right now. And that has to do with, when you take away what is it called? Like the extras, the incentives, the bolstering that they did, when that goes away. So be thankful. Yeah, be happy you have a job, be happy you have a way to earn a living, but also be happy they're picking up a lot of this stuff for you, because it's not a small number. So whatever you think about your job, there's a lot to it, and this takes care of your family too. So there's that. So I thought it was kind of an interesting, and again, this is one study, but this is 15 years, and that's a big jump. We all feel it. So there you go. I just thought you might want to know. I will take this off and let you enjoy my, what is it? Carrot top hair one more time. I hope you're having a good season. And as open enrollment barrels on, you're making good decisions. And if you have any questions, I do have one that I'm going to answer in a recording in just a minute. It's about dental stuff. Oh, I could talk about dental stuff all day. All right. Time to go out there and get some good medicine and give some good medicine.